My name is Dr. Aubrey Wallace, and I'm going to talk to you about what to expect if you come in for a live blood analysis session. So you'll see on the website, live blood analysis here is a 45-minute consult. It costs $125, and it's a technique of viewing your living blood in real time in both bright and dark field microscopy. The reason we do live blood analysis is to get a snapshot of your current health of your living blood. So it's exciting to look at that. All right. The most important thing to start with if we're doing a live blood analysis is actually that you fast for 4 hours before your appointment time. So you're not going to eat any food, any coffee, or any tea 4 hours prior to your appointment. You can drink water, and I would suggest you do drink water because it's helpful in seeing hydrated blood when we work on it. When you come in the office, we're going to clean your hand, and we'll take a 1 lancet sample of a droplet of blood, and we're going to put it onto a slide. And we're also going to take a little bit more blood out of that spot and put a few layers onto another slide to do what we call the dried blood analysis. This, when we put it on the slide, will be what you'll see first. So something will look, the live blood under the light field microscopy, you'll be able to see the background will be all your plasma, and inside the plasma you'll see your red blood cells, and they'll be floating around, and you'll get to also sometimes see white blood cells in there doing their jobs as well. So the white blood cells show us how much your body is fighting infection and what types of infection and what's going on with you there. And the red blood cells show a lot of different things. So they show vitamin deficiencies, they show problems with protein absorption. Sometimes they'll be able to show that. You can see on this picture that they also have, some of them have little chunks out of them. Sometimes this will actually show parasitic infection, just some damage to the cells, or that they've been too roughly moved through the blood if there's hypertension, that sort of thing. You can also see the depth of the size of the cell will show whether or not the cell might be anemic, if there's not enough iron in the cell, and the variety you can see sometimes of the sizes of the cells. Here's a different picture. These show, these have a single membrane protein stick out there. That kind of shows we're looking at problems with possibly B vitamin management. And you've got kind of different sizes of the red blood cells. They should all be uniform on this one. And so these are actually showing me this person might have some problems with B vitamin deficiency. The blood will actually, if the terrain of your blood is not doing very well and it's kind of toxic, you'll actually be able to see, even in the bright field analysis, the cells will stick together. This is called rouleau, and they'll all line up. And that's not a very good thing for them to do. It means that they've lost their charge in the specific way they are, and that we need to really work on detox for this person. You can also see in the background here fibrin networks that have grown in the plasma. And that's a very strong sign that there's something going on with the liver, and that we need to do more work to get that one taken care of. If you look carefully here too, you can see a rod-formed bacteria there at the bottom, and that actually is a pretty good sign this person's immune system is not taking care of business there as much as we'd like for that to be. So you can sometimes see the bacteria just moving around in the plasma as well. Then we'll go into the dark field, and the dark field, as you can see here, we can see a lot more in the dark field than we can in the bright field analysis. You can see in the background, you'll see a lot of those little dots are actually chylomicrons, or those are fat that move through your plasma. And so we'll be able to tell, is this person not absorbing their fats well, or how are they doing with them? You can still see the shape and the size of the red blood cells, and then we can get a really good look at the white blood cells. So right here, this is actually a monocyte, which is a type of granulocyte, very big blood cell. And over here is a neutrophil, very shiny one. And these two guys are fighting infection in your body. And this is a chondrite, or you can see as the body starts to break the blood down, sometimes there will be very large form little tiny microorganisms that come out of the red blood cells. And that shows us that your body's had some degeneration and that you need to work with it in order to keep your terrain improved enough that those sort of little guys are not showing up in your blood very much. After we finish the the dark field analysis, then we'll also look at something called the dried blood. So when we go into the dried blood, and this will just kind of be a little zoom in through some of the dried blood, we're actually looking at the different layers of blood. This is just one layer of 8 layers we'll see on that slide. And you're looking for those little lighter areas called protein puddles, protein plasma puddles, PPPs. And we tell by the protein plasma puddles, those are how we determine how much disorganization is happening in that layer of the body. So this part of the analysis really gives us a lot more information about body systems, organ function, intestinal absorption, connective tissue issues, also heavy metal toxicity. This is actually a pretty strong sign here. Heavy metal toxicity will come in with a lot of red blood cells looking almost like a skin layer, and then you'll see dark lines come in. This is not a complete heavy metal one, but you'll be able to see that in this layer of the blood as well. So that's kind of an overview of what I mean by live blood analysis. The appointment time takes about 45 minutes to complete, and then we spend about 15 minutes discussing some options for you on supplements or things that I would suggest based on what I find in that. Live blood analysis is not a diagnostic tool in the state of Washington. It is used just to help you get a snapshot of your lifestyle factors, see what we might think would be the best direction to go. And it's fun because you can see your own living blood, and it's right there in real time. It helps you really get a sense of what's going on inside of you. So if you have any more questions, you can check out our FAQ section on the website, or you can call our office. Looking forward to working with you.